الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Psittacosis due to Chlamydia psittaci, which is occupational infection, by Professor Mahmoud Hani Sulaiman. Definition of ornithosis, parrot fever, or psittacosis. Psittacosis is a systemic infection that frequently causes pneumonia. Epidemiology, it is acquired by inhalation after exposure to infected birds, e.g. parakeets, parrots, macaws, and cockatoos. Most of them are tropical birds. Please ask Google about these specific birds to see what they look like, or less commonly from domesticated animals. Occasional patients provide no history of relevant exposure. Because of this exposure, it is called bird fancier disease and can affect those working with these birds. Microbiology, the etiologic agent is Chlamydia psittaci of the family Chlamydiaceae. Clinical picture. Psittacosis is an acute respiratory tract infection with systemic symptoms and signs that often include fever, non-productive cough, dyspnea, headache, myalgia, chills, and malaise. Less common symptoms include pharyngitis, diarrhea, constipation, nausea and vomiting, abdominal pain, arthralgia, rash, and altered mental status. Still in clinical picture, extensive interstitial pneumonia can occur with radiographic changes and more severe than would be expected from physical examination findings. Rarely infection with Chlamydia psittaci, this is important and strange. Rarely infection with Chlamydia psittaci reported to affect systems other than respiratory tract, result in conditions including endocarditis, myocarditis, pericarditis, dilated cardiomyopathy, thrombophlebitis, nephritis, hepatitis, cranial nerve palsy, including sensory neural hearing loss, transverse myelitis, meningitis, and encephalitis. Infection in pregnancy may be life-threatening to mother and cause fetal loss. This is Chlamydophila psittaci pneumonia in a 16-year girl with cough of 3 weeks duration. The family had several parrots in home. Interstitial pneumonia, most prominent in lower lobe of left lung, is showing here in this picture. Complement fixation titer for psittaci, Chlamydia psittaci, is 12128. Lateral chest radiograph of the patient in last image. Diagnosis is made serologically in most cases. When available, PCR may be positive. Because diagnostic methods are imperfect, treatment should not wait definitive diagnosis. This direct fluorescent antibody stained mouse brain smear reveals presence of bacterium. Chlamydophila psittaci. Psittacosis is acquired by inhaling dried secretions from birds infected with Chlamydia psittaci. Although all birds are susceptible, pet birds and poultry are most frequently involved in transmission to humans. Therapy. Doxycycline can be used for short duration, i.e. 21 days or less, without regard to patient age. Erythromycin and azithromycin are alternative agents and recommended for pregnant women. Therapy should continue for 2 weeks after fever abates. Therapy should continue for 2 weeks after fever abates. Most psittaci infections are responsive to antimicrobial agents in 2 days. In patients with severe infection, intravenous doxycycline may be considered. Prevention: treat imported birds. Treatment of birds that have suspected infection. وفي النهاية أقول الحمد لله رب العالمين و thank you.